performing hand hygiene. Hi, I'm going to be your student nurse today. I'm Courtney Neitzel. How are you doing?
Good, how are you?
I'm good. Can I get your name and date of birth?
Grace Robishaw, 02/21/2003,
Perfect. And then do you know where we're at today?
SVSU,
And who's the president?
Biden.
Good. So you're A&O times 3. I'm going to ask you a few questions. So are you on any medications?
Lexapro.
Okay. And any side effects with those at all?
Nope.
Okay. Any past surgeries that I should know about?
I had a diagnostic laparoscopy.
Okay. And were there any complications or anything with that?
Nope.
Perfect. Do you take any supplements or herbals?
Nope.
Okay. Do you have any allergies?
No.
Okay, perfect. And then, let's see. So these might be a few more personal questions. Do you smoke?
No.
Do you drink?
No.
Do you vape at all? And then any other drugs that I should know about? Okay. And then how about your family history?
I don't have anything.
Okay, perfect. And then 2 more. So what does your diet look like?
I get all the food groups with fruits and vegetables.
Okay. And about 3 meals a day?
Mm-hmm.
Okay, perfect. And then what is your exercise regimen?
I exercise 3 times a week.
Okay, perfect. All right, so that is all the questions I have for you. I'm going to move on to vitals next. So is it okay if I take your watch off?
Go ahead.
Okay. I'm gonna have you take it off for me. All right, let's set this over here. Okay, so first I'm going to feel for your radial pulses. Good, those are both symmetrical and equal. Next, your brachial pulses. Good, those are symmetrical and equal. Next, I would take your temperature, but I don't have a thermometer. So usually the normal range is about 98.6, around there. So I'm going to assume that's your temperature. And then next I would look at, or do your O2 saturation, but I also don't have that machine. So I'm going to look at your hands for clubbing. Could you go like this for me? Perfect. I don't notice any clubbing. Everything looks good. I'm just going to do your capillary refill while I'm here. Good. Less than 3 seconds on that hand. And less than 3 seconds. So your capillary refill looks good. O2 saturation looks good. Next, I'm going to take your heart rate. So that's just going to take a minute. Okay, good. So your heart rate was 78 and your respirations was 18, so that's good. Next, I'm going to take your blood pressure. Do you have a preference for which arm?
No.
Okay, perfect. I'm going to do it on your left arm, if that's okay. Alright, can I have you put your arm out like this? Just gonna slide this up a little bit. Perfect. Let me know if it's too tight or too loose. Does that feel good?
Mm-hmm.
Okay. Put this right here for a second. Okay, you can relax your arm now. So I'm gonna listen with my diaphragm. Okay, that was 124 over 82. That's good, within normal range. Alright, I'm gonna set this over here. Okay, so all of your vitals looked good. I'm not concerned with any of that. So next I'm going to move on to your cranial nerves. So first, for the first cranial nerve, I'm going to have you close your eyes. I'm going to have you smell this and let me know what you smell.
Coffee.
Perfect. So your cranial nerve 1 is intact. Normally I would check cranial nerve 2, which is your optic nerve, but we do not have a Snellen chart, so I can't do that one. So next I'm going to check for cranial nerves 3, 4, and 6. Do you have any glasses or contacts that you wear?
I have glasses
Okay, and how often do you wear those?
when I'm driving.
Okay, perfect. So do you have any issues with light in your eyes?
No.
Okay, perfect. So I'm just going to shine this at the bridge of your nose just to look for constriction. So just look straight forward. Okay, no constricting. Now I'm going to look at each individual eye. Good. Good. So your eyes look perla. They are dilating with light and accommodating, and those look good. I'm also going to do the 6 cardinal fields. So I'm going to have you look at my pen and only moving your eyes. Just follow my pen light. Okay, those look good. Now I'm going to have you look at my pen light and focus on something in the back of me. Do that a few times. Okay, perfect. So everything is looking good with your eyes. Can you lift up your eyebrows for me? Just perfect. That was also cranial nerve number 3. Next I'm going to do cranial nerve number 5. So I'm going to have you clench your jaw, and then I'm going to have you swallow. Okay, any issues with that? No pain? Okay, perfect. And now I'm going to take my cotton swab, so it's just a dull spot. I'm going to poke a few spots on your face and just let me know where I'm poking. Could you close your eyes for me?
Forehead. Right cheek. Chin. Nose. Left cheek.
Perfect, that was good. So cranial nerve 5 looks good. Next I'm going to do cranial nerve 7. So I'm going to have you make a few faces for me. Can you smile and frown? Can you make a mad face? Can you puff your cheeks out? Okay, perfect. Cranial nerve 7 is looking good. Next is 8. So 8 would be like balance and hearing. So I noticed that you're hearing me pretty well. Do you have any issues with your hearing?
No.
Okay. So I'm also going to check that cranial nerve later on in my assessment. I'm just gonna have a look at your ears. Okay. Everything looks good there. Next I'm going to check cranial nerves 9, 10, and 12. So those are gonna have to do with your mouth. So can you stick out your tongue for me? Can you lift it up and down and side to side? Okay, perfect. Now I'm just going to use this, and could you open up for me and say ah? Okay, perfect. So that all looks good. Yeah, so that was 9, 10, and 12. Cranial nerve 11 is with your shoulders. So I'm gonna push down. Could you resist when I'm pushing? Perfect. That seems intact. That one looks good. So that was all your cranial nerves. I'll check 8 and 11 again later on. Next, I'm going to do a skin assessment. So your face seems good. Do you have any issues at all that I need to be aware of?
I have acne.
Okay, all right. So your face looks symmetrical. Everything looks symmetrical. Your lips look good. Okay. I'm going to have you look straight up for me. Your sclera is white. Conjunctiva is pink and moist. That looks good. And then could you close your eyes for me? Okay, your eyelids look good. No excess moisture. I'm going to palpate your sinuses. So let me know if there's any pain or tenderness.
No pain.
Okay, so that looks good. Now I'm going to check your ears and palpate your pinna. Looks like you have some piercings. Do you have any issues with those?
No.
Okay. I'm gonna take a look in your ears. Everything looks good over there. I'm gonna palpate your pinna and your lobe. Everything looks good. Now I'm going to have you look up. I'm just gonna take a look in your nose. I'm gonna give you a little big nose. It looks like you have a little bit of a deviated septum. Do you have any issues with that ever?
No.
Okay, perfect. So now I'm going to take a look in your mouth again, just to make sure those mucous membranes look good. So I'm gonna have you open up for me and say ah again. Good. Go to the side. Everything looks pink and moist in your mouth. Do you have any problems with your teeth at all?
No.
Okay, those looked good. All right. Now I'm going to palpate your lymph nodes. So this is your pre-auricular and your post-auricular. Those are non-palpable. Your occipital, your submental, non-palpable, submandibular, non-palpable. Your cervical chain looks good, non-palpable. Now I'm going to have you pull your shoulders forward. I'm going to feel for your suprascapular. That feels good. All right, or supraclavicular, sorry. That felt good. I'm gonna check for tissue turgor while I'm here. That looks good, no tenting, so that means that you're not dehydrated or anything like that. I'm gonna check your hair. Do you ever have any itching or dryness?
No.
Okay. Alright, that all looks good. And now I'm going to look at your arms. Temperature feels good. Just gonna look this up. I notice you have a tattoo. Do you have any issues with that?
No.
No infections?
No.
Okay. Everything looks good. I already checked your capillary refill. Check this arm. Temperature feels good. Alright, checked your capillary refill earlier. Alright, put that hand down. So it doesn't look like there's any excess moisture, not dry, so it looks good. Now I'm going to palpate for your carotid artery. So one hand at a time. Good. And good, that feels good. Now I'm gonna auscultate your carotid artery with my bell. So I have my bell activated. Good, no whooshes or bruises. Good, no whooshes or bruises. That sounds good. Okay, I think that's all for the front. Now I'm going to move to the back. Okay, could I have you move a little bit back further for me? Okay, perfect. Okay, first I'm going to feel for your thyroid. I'm going to push one side in and palpate, and then the other side, palpate. I feel that your trachea was aligned, so that looks good. I'm just going to separate your hair, put it right there. Okay, your spine looks nice and straight. Have you ever been to a chiropractor at all?
No.
Okay. Or have you had any spinal issues or anything like that?
No.
Okay, perfect. So I'm going to put my hands on your back and I'm going to have you take a deep breath for me. Okay, perfect. My hands are moving bilaterally. Everything looks good so far. Your temperature looks good. Nice and normal. Okay, now I'm going to palpate. I'm going to percuss, sorry, not palpate. I'm going to listen for resonance in your lungs. So could you put your shoulders back for me just so I can see where your scapula is? Okay, perfect. All right, you can relax now. I'm going to percuss. So you're gonna feel a few movements. Is it okay if I move your bra a little bit?
Mm-hmm.
Is it okay if I lift your bra up a little bit?
Yep.
Okay, so I'm noting resonance throughout, so that's good. Now I'm going to move on to auscultating. So I'm going to put my diaphragm on your back. I have to listen to 12 spots. About halfway through, I'll see if you need a break and we'll take a little breather. But I'm gonna have you take a deep breath every time I put my stethoscope on your back. Do you need a break at all?
No.
Okay. Okay, I'm just gonna lift your bra up again if that's okay.
Yep.
Okay, perfect. So that all sounds good. I'm not noting any wheezing or crackles, so that's good. Okay, now I'm going to have you lay down for me. Okay. So I'm gonna take the pillow from you for a second. Okay. I'm going to inspect for JVD. So I'm gonna have you look forward or straight up, and then to one side, and then the other side. Okay, it looks good. I don't notice any JVD. If I did, I would put you up to a 45-degree angle and assess from there to see if it's still there. So that all looks good. Is it okay if I pull your gown down a little bit?
Mm-hmm.
Okay. All right, I'm gonna pull it to right there if that's okay.
Mm-hmm.
Okay, now I'm going to listen to your heart with my bell and my diaphragm to assess for lub dub with my diaphragm and any murmurs with my bell. So I'm gonna start with that. Okay, so first I'm gonna find your clavicle, and then I'm gonna find the second rib, or the first rib. This is your first rib, first intercostal space, second rib, second intercostal space. So this is your aortic. And I'm gonna listen for a second with my diaphragm. That sounds good. Now I'm going to switch over to my bell. Okay. Okay, I don't notice any murmurs. I'm gonna switch back to my diaphragm. Now I'm gonna go to your left clavicle and find your first rib, first intercostal, second rib, second intercostal. This is your pulmonic. I'm noting lub dub. I'm gonna switch to my bell. Okay. I'm not hearing any murmurs. Is it okay if I pull this down a little bit?
Mm-hmm.
Okay. I'm gonna go down to your next rib in your next intercostal space right here, which is your Erb's point. So first I'm gonna listen to my diaphragm. Good. Now I'm going to switch it to my bell. Okay, good. I don't hear any murmurs. Now I'm gonna take my finger. Is it okay if I go under your bra?
Yeah.
Okay. So I'm gonna meet my finger right here and then go down one more rib and then to her next intercostal space. This is her tricuspid. Good. I don't hear it, or I hear lub dub. So now with my bell. Okay. I don't hear any murmurs, so I'm gonna stay on my bell. And I'm gonna go down one more rib, next intercostal space, and I'm gonna meet her mid-clavicular. So we're gonna slide over. And this is her mitral or her apical pulse. So I'm gonna listen to my bell first. Good, I don't hear any murmurs. Next, I'm gonna listen to my diaphragm, again at her apical pulse. And here I'm going to listen for a minute. Starting now. Okay, good. So your apical pulse was 76, so that's good. I'm gonna pull this back up for you. Now I'm going to inspect your abdomen. Is it okay if I lift up your gown? Okay. So I'm gonna lift it up to about where your bra ends. Could you pull down your shorts a little bit for me? Perfect. So first I'm going to inspect your abdomen, noting contour and symmetry. I'm gonna look over here. Okay. Could you hold your breath for me so I can look for your aorta pulsing? Perfect, that looks good. You can breathe now. So I inspected your abdomen first. Now I'm going to auscultate your abdomen. Using my diaphragm. So I'm going to start in your right lower quadrant. I'm going to listen for bowel sounds, so 5 bowel sounds or 5 minutes in each quadrant, or whichever comes first. All right, that was 5 bowel sounds. Five bowel sounds. Now moving to her left upper quadrant. Five bowel sounds. Now to your left lower quadrant. Okay, good. So that was 5 bowel sounds in each quadrant. Now I'm going to listen to your aorta and some arteries with my bell. So first I'm going to listen to your aortic artery. Good, no whooshings or bruits. Now I'm going to listen to your right renal artery. And your left renal artery. Your left iliac artery. Good. And your right iliac artery. And good. I don't hear any bruise or whooshing, so that's good. Now I'm going to go on to percussing your abdomen, so like I did with your back when I assessed your respiratory. So let me know if you feel any pain or tenderness. I'm just going to be listening for tympani in the abdomen. Good. That was your right lower quadrant. Good. That was your right upper. Good. I'm hearing tympani. Okay, good. It's a little dull in your left lower quadrant, but that could just be because of stool. So now I'm going to percuss for the borders of your liver. Start in your right lower quadrant, noting from tympani to dull. Okay, I noted that, or the borders of your liver. That seems to all be good. Now I'm going to palpate your abdomen. So it's gonna start with a light palpation. Let me know if you have any pain or tenderness. I'm gonna start in your right lower quadrant. Any pain?
No.
Good. Now I'm gonna go a little bit deeper palpations. Let me know if there's any pain here. Okay, any pain with that?
No.
Okay, perfect. So everything with your abdomen looks good. I can lower this now. So now I'm going to move to your femoral artery. I'm going to palpate for them and for symmetry, and then I'm going to auscultate. So is it okay if I lift up your shorts a little bit?
Yes.
Okay. Okay, good. They both feel strong and equal. Now I'm going to auscultate with my bell. Okay. That sounds good. And that also sounds good, so I can pull this down. So your femoral arteries looked good. Now I'm going to feel for your popliteal. So those both feel strong and equal. Now I'm going to feel for your posterior tibialis. Those feel strong and equal. Now for your pediis, or your dorus pediis. And those both feel strong and equal. Okay, so all of your pulses felt good. I'm gonna feel for temperature down your legs. Good, even temperature throughout. And same with this leg, even temperature throughout. I'm gonna check for edema. Good, I don't notice any edema. Okay, now I'm going to do your capillary refill on your toes. Good, less than 3 seconds. Good, less than 3 seconds. So I'm also gonna look at the bottom of your feet, and then I'm gonna lift your leg up. Perfect. And that looks good. Now I'm going to do some sensations on your legs. So this is gonna be soft, and this is gonna be sharp. Do you notice a difference?
Mm-hmm.
Okay, so I'm gonna do that throughout your legs, and I'm gonna have you close your eyes. Let me know which sensation you feel and if, or where it's at.
Sharp right thigh.
Good.
Sharp left knee. Soft left knee.
Good.
Sharp left thigh. Sharp right shin. Dull left shin.
Good.
Dull right knee.
Good.
Soft left shin.
And then for your feet, it's just gonna be all one sensation. It's gonna be the dull one. Just tell me where I'm putting it.
Left top of my foot. Left bottom of my foot. Right bottom of my foot. Right top of foot.
Okay, perfect. So all the sensations look good. I'm just gonna take a look at my rubric real quick. Okay. All right. Now I'm going to have you sit up for me. Okay. And then I'm gonna have you put some socks on. Let me know if you need any help with that. Okay, and then I'm also just gonna have you put your shoes on right now. Here's one, let me know if you need any help. Make sure this doesn't fall forward. Okay, good. So next I'm going to feel, or do a few more tests. I'm gonna test your cerebellar function. So I'm gonna have you look at my pen light, and then I'm gonna have you touch your nose and touch my pen light. So your cerebellar function all looks intact. I'm gonna check some of your musculoskeletal system. So first I'm gonna have you, like we did before, just push up. That's testing cranial nerve number 11 again. And then do you know how to do like the front stroke and back stroke?
Mm-hmm.
Okay. I'm gonna have you do the back stroke first. Good, I don't feel any cracking, any pain.
No.
And then front stroke. All right, perfect. That looks good. No pain there at all?
No.
Okay, I'm gonna have you do some of these. Perfect, any pain?
No.
Okay, I'm gonna have you squeeze my fingers. Okay, that feels symmetrical. Strength is even throughout. Could you move your wrists like this? Perfect. Okay. And then I'm going to have you put your hands like this. Could you push up and push down? And then go like this for me. And then push in and push out. And then next, I'm going to feel it for your knees. Could you kick out for me? Perfect. Okay. I'm sorry, I'm going to have you take your shoes off real quick. One more time. Okay. Sorry about that.
It's okay.
So I'm going to have you push in with your feet and push out and push down and push up. Okay. So that all seems to be working good. And then can you twist your ankles for me? Perfect. Any pain with any of those?
No.
Okay. Now I'm going to check your patellar reflex. So I'm just going to have you dangle your legs. There we go. Try that one again. Perfect. Perfect. Any pain with that?
No.
Okay. Now I'm going to have you put your shoes back on. Here's the other one. While you're doing that, I'm just going to check my sheet one more time. Okay, so I'm just gonna check for muscles. Any pain with that?
No.
Any pain down here?
No.
Okay, and then your ears look symmetrical. Everything looks good. Okay, so now I'm going to have you put your fingers like an okay sign, and then can you touch your fingers to your thumb, and as fast as you can? Perfect. And then I'm going to have you put your hands on your legs and go back and forth and as fast as you can. Perfect. So I'm confident that you are able to stand. So I'm going to have you stand up. Would you like me to tie your back at all?
No, it's okay.
Okay. So I'm going to have you stand here a little bit further apart. Perfect. Right there. And then put your hands down. And I'm going to have you close your eyes for about 10 seconds. Okay, you can open your eyes. So I noticed slight swing, but nothing too concerning. So that looks good. So that's a negative Romberg. So that's good. Now I'm going to have you stand next to me. And I'm going to have you go heel to toe. Okay, now you can turn around. Perfect. And then can you do your normal gait now, forward? Perfect, and turn around. Okay, perfect. So I'm gonna have you sit back down now. So her Romberg was negative. Everything looked good. I don't notice any abnormalities throughout her assessment. Her Braden scale score would be a 23. So thank you for being my patient.